everyone. Thank you so much for joining me today. This is going to be part one of a three-part series, so don't forget to hit the notification bell and subscribe to my YouTube channel so you don't miss the next two videos and any other amazing videos. It seems like I've had so many coccyx patients coming into the office recently, so I decided to do this series on tailbone pain during pregnancy and in the postpartum period. The coccyx, otherwise known as the tailbone, is a triangular bone at the bottom of the spine. Really interesting fact is that it's actually a vestigial tail that disappears at about 8 weeks of gestation, hence the name tailbone. But it's a very little bone, but it has lots of important functions. So the tailbone actually works with the sit bones to promote a tripod or a three-point support system when we're sitting in order to help us distribute our weight during sitting. That's why so many people with tailbone pain have a hard time sitting, and it's very, very painful. So it helps for seating stability and to distribute our weight. Also, the coccyx is a very, very important point of attachment for so many pelvic floor muscles. So therefore, the coccyx plays a role in core stability and strength. The coccyx also helps to aid the anus in defecation. It helps to support the vagina in women, and it also helps to support and stabilize our legs during movement. So small bone, very, very, very important functions. The interesting thing is that women are actually 5 times more likely than men to have tailbone pain. There are a few reasons for that. One of them is differences in anatomy. We won't really go into that today, but women are much more likely to have tailbone pain than men. Why is tailbone pain or coccyx pain so common in pregnancy and in the postpartum period? Well, an obvious answer is posture. There are so many predictable changes in posture during pregnancy, and those changes in the center of gravity can change the position of our pelvis, and it can also change which muscles we're using or overusing. So that's a very common reason why pregnant and postpartum women have pain in their tailbone. Another reason is the positioning of the baby in mom's belly. So if the baby is positioned posteriorly, the head of the baby can actually be putting pressure on the sacrum and the coccyx and be a source of discomfort for moms. Another reason is pelvic floor muscles that are overactive or in spasm or are weak. A weak pelvic floor won't support the tailbone enough, and a tight pelvic floor that's in spasm can actually pull the tailbone forward and be a source of pain for women. Another very common reason for tailbone pain more in the postpartum period is prolonged phase of pushing during labor and delivery. There's a muscle called the coccygeus that attaches to the coccyx and comes out to the side of the pelvis, and when this muscle is in spasm, which often happens during prolonged pushing during labor, that muscle can go into spasm and actually pull the coccyx forward and be a source of pain for women. Another reason is birth trauma. So our bones move in a very predictable way during the birthing process. And we would like to think that those bones always go back into the anatomical position, but sometimes they don't, and moms need a little bit of help from a physical therapist to help get those bones back into their anatomical position after the birthing process. Another major reason is we all know that the source of pain, or where people are feeling pain, is not always the root cause of the pain. So if people are feeling pain in their tailbone, we have to find whether that is the origin or the root cause of the pain, because tailbone pain can be referred pain from the hips, from the low back, even from a C-section scar. So we need to assess not only where are you feeling the pain, and of course we want to reduce the symptoms of the pain, but we want to find the root cause of the pain so we can fix the problem and not only put a Band-Aid on it. Now that we know the common reasons why moms may have tailbone pain, I know you all want to know, what can I do for it? So there are so many things that we can do to help you resolve tailbone pain. The good thing about the coccyx and the pelvic floor muscles is that the pelvic floor muscles are skeletal muscle like any other muscle in our body, and it responds beautifully to manual therapy. So a good pelvic floor therapist will have many manual therapy skills and techniques that they can help implement to help resolve pelvic pain. The other thing that we want to be sure of is that your core components are coordinated and working together the way they should be. We want to make sure that the respiratory diaphragm is coordinated with the pelvic diaphragm, because that will directly affect the tone of the pelvic floor muscles, which we now know will directly affect the coccyx. Postural training. So we want to help moms optimally. We like to get moms in during pregnancy so that we can avoid compensatory patterns of pain in the postpartum period, and we can work with them on their posture during pregnancy. But in the postpartum period, we always want to retrain neutral alignment and posture, because our core components and our joints communicate better when they are in optimal alignment. We can also teach moms exercises for home to help them work on resolving their coccyx pain at home. So good home exercise program is really important. And pelvic floor muscle training. The pelvic floor muscles should be able to contract and they should be able to relax. And we want to make sure that they can do both. If the pelvic floor muscles are too tight or in spasm, we can implement a relaxation program. And if they're too weak, we want to implement an individualized strengthening program. We can also work on body mechanics, because we know that we're in pain. We use muscles that maybe are not needed for that specific movement because we're guarding. So we want to do body mechanic training so that we make sure you're using the right muscles for the right activities. I think you're getting the idea that there is so much that we can do to help you resolve tailbone pain. Our next video is going to be a short video on tips to help you figure out whether your tailbone pain is actually coming from your tailbone. It's always best to go to a physical therapist and have them evaluate you, but sometimes it's nice to be able to get a head start and problem solve. And our third video is going to be on some simple stretches you could do at home if you are having tailbone pain to get you started on your healing process. But make sure that if you do have tailbone pain, you get in to see a pelvic floor physical therapist. We can help. We can help you sit pain-free, and we can help you move pain-free. Have an amazing day. Thank you so much for spending a few precious moments of your time to learn with me today.